Hi, my name is Asia McDowell.
Oh, hi, how's it going?
Um, you can call me Miss McDowell or Dr. McDowell. How would you like to be addressed?
You can call me Hannah.
Okay, Hannah it is. Okay, this meeting is expected to be, uh, it's going to last roughly around 30 minutes, give or take, with the maybe like a 10, 15 minutes towards the end, so I can draw up a treatment plan for you if necessary. So, yeah, at the end of the session, I would like to accomplish freezing and behind your visit, and if needed, a possible treatment plan. So I'll say maybe roughly around 45 minutes. Okay, is that okay with you?
Sounds good.
Okay. So what brings you in today?
Um, I've just been feeling like really just depressed and like down and just like not like my normal self recently. Um, and just having like a hard time, I think.
Okay. So I have a series of questions I would like to ask for screening on a scale of 1 through 5, with 1 being never and 5 being almost always. Tell me where you range after each question. Okay.
Hmm.
Okay. So, depressing moods most of the day.
Um, I'd say like 3 or 4.
Okay. 3 or 4. What about loss of interest in activities that you used to engage in?
Like 4.
Any significant weight loss or gain?
Um, like 4. I've been gaining weight.
Have you noticed with that weight gain, has your eating patterns changed? Have you switched up on things that you normally eat or
Um, I think maybe I think I've been like comfort eating.
comfort eating? Okay. What about your sleep patterns? How have you been sleeping at night? Any insomnia?
It takes me a while to fall asleep. Normally, once I'm asleep, I'm okay, but it takes me a while to fall asleep.
Okay. Any loss of energy or fatigue feeling?
Yeah, I feel like I'm just like pretty tired all the time. Even if I don't really do anything, I just feel kind of tired and dreary.
Any feelings of worthlessness or guilt?
I'd say like 4, like 3 or 4.
Any reasoning behind that?
I don't think there's really like one specific reason. Um, I don't know. I think just I've been going like a lot of stress and stuff and not feeling like I'm good enough or I'm not smart enough to do it. Um, just like stress with like school and stuff. Um,
Okay. What about any thoughts of death or suicide?
no.
Okay. Have you ever acted on verbal or physical threats to hurt others, animals, or property?
No.
No? Okay. Okay. Good. So when did you first notice these symptoms?
Um, I'd say the past, but they started around like a few months ago. But I feel like just in the past few weeks, it just gotten a lot worse to the point where it's like unbearable or just really like disabling from my daily life.
Okay. So when did you first seek help? If you, or have you seeked any help?
Not yet. This is my first time um, with a
Okay.
professional.
Has anything in your life changed recently?
Um, I recently moved out of my parents' house into my own apartment, and so that was just kind of a big change. Um, Not being close to my family.
Okay. And I do understand that um, when I first moved, I didn't move far, but when I first moved away from my family, I experienced that too. So I do understand that. Okay, so any events in your life that outside of school that may be exhausting?
Um, I work a lot, so and I used to love my job, but I think now it's just gotten like I just don't enjoy it anymore, and I don't know if it's just the depression or if it's just the job I don't like doing anymore. I just find it like exhausting, and it's just kind of like my life's on repeat, just school and work. That's it.
Okay. And how has this affected you?
Um, I mean, I think it's definitely affect my relationships with people. Um, and like I'm not really hanging out with friends. I'm not being my usual like talkative and outgoing self. And normally I like to do things and hang out with people, but just recently I just haven't been in the mood for it.
Okay. How do you view your current level of functioning?
Um, I mean, I'm still able to get up and get out of bed and brush my teeth, and I'm still able to do that. I think it's just I'm still able to function. It's just feels exhausting to do it.
Okay. Have you ever been hospitalized
No,
for this, of course?
no.
No? Okay. All right, let's see. So now I want to visit your past psychiatric history. Okay. So you told me when the first time that you noticed these symptoms coming was a little while back. You said you'd never had treatment or anything before. Okay, let's do. Okay, and you said no suicidal thoughts and behaviors. Okay, so have you just been feeling sad, blue, down, depressed, or irritable?
Yeah, I think all
Okay,
of those.
okay, so let me ask you this. I'm assessing these notes and getting things together. So most of the things, is it fair to say most of the things that you're doing now, and it's like the pleasure is gone? You're not really enjoying life?
Yeah.
Okay. So have there been times when, are there like any breakthroughs? Is it like a consistent everyday thing, or is it maybe like 3 or 4 days of depression and then a breakthrough, like a few days when you like felt the opposite of depressed, when you were very cheerful or happy and it felt like you were your normal self again?
Um, I feel like the depression is always there, but it like
Hmm.
some days it's better, but it's still there. I wouldn't necessarily say that like I have like very cheerful and happy days. I would just say like the depression's always there. It's just some days it's not as bad.
Okay. So, what about your past medical history? Do you have any chronic medical problems?
None that I know of yet.
Okay. Have you ever undergone surgery?
I had tubes in my ears when I was a baby, but that was it.
Okay. Any seizures? Have you ever experienced any seizures or hit your head so hard that you lost consciousness?
No,
Okay. And do you take any medication for any illnesses?
no.
Okay. What about medications or supplemental vitamins?
Um, Not really. Like sometimes I'll take those like little like gummy things, um, like multivitamins, but I don't really do that daily. I should, but I don't.
What about any recreational drugs?
No.
Over the counter?
I mean, I'll take like Excedrin for like headaches, but that's it. It's
Okay.
but that's every once in a while.
Okay. And be cautious with those Excedrin because they're full of caffeine.
Yeah.
They're addictive. Okay. So, are you allergic to any medications or any? Do you have any allergies?
None that I know of.
Okay. So, what about your family history? Does anyone in your family experience these type of symptoms?
Um, my family doesn't really like talk about that kind of stuff. To my knowledge, they don't. But then again, we don't really talk about it, so I wouldn't really know.
Okay. So, no known history of anyone with nervousness or nervous breakdown, no depression,
No.
mania. Okay. What about any problems like schizophrenia, problems resulting from excessive drinking or drug abuse?
No.
Any made suicide attempts or that have anything that's required any psychiatric or hospitalization?
No.
Okay. Okay, so now we're going to move forward to your developmental history. Do you know if your mother had any difficulties during her pregnancy or delivery?
Um, I was a C-section, but other than that, no.
Okay. What were you like as a child?
Um, I know my mom always said I had like a very wild imagination, and I always liked to play.
Mm.
I used to love to play dress up, and I had like a little kitchen set that I used to like to play kitchen. But I'd say I had a pretty good childhood. I was a happy kid.
That's good. Yeah, that's good. Did you have any problems during your early childhood?
Um, I don't think so.
Okay. When did you reach puberty?
I'd say around like I was in like fifth grade, so I feel like relatively young compared to my other classmates.
How did you feel about that?
Um, I remember at the time it was hard, but like now it's no big deal. Like I know that now, but at the time it was like frustrating and hard for me.
Okay. So, social history. Let's get into that. Okay. Did you have any behavioral or learning problems during your early childhood?
No.
Okay. When you started school, did you have any trouble relating socially or keeping up academically with your classmates because of behavior or learning problems?
Um, I didn't have any trouble academically. I remember like in middle school I was bullied a little bit. Um,
Mm,
but that was that.
I was too. So I know what that's like.
Yeah.
Yeah. Middle school is the toughest time. I currently work in the school system as well as outside of this. And there's an old saying that says, when you die, if you don't make it to heaven, God sends you back to middle school. So, okay. How far did you make it in school? What we know you're in college. You said that you had trouble with your college. So, is this what year are you? Are you undergrad? Are you
I'm in my first semester of my um, first year of graduate school.
okay? Okay. Who lived in your home during your childhood?
It was me. I have a younger brother who is 4 years younger than I am, and both my parents and then my maternal grandparents. Um,
Okay.
so there were six of us in the house.
Okay. Was religion part of your upbringing?
Um,
Any type of
my
religious faith?
my grandparents and my mom were pretty religious, and they raised me to be very religious. Um, like nothing crazy, but just like going to church on every Sunday and going to Sunday school. I had perfect attendance in Sunday school. Um, but I don't really go to church anymore just because I'm very busy.
Mm,
Like growing up, I always had to go to church every Sunday.
me too. Okay. How do you support yourself?
Um, I I've worked since I was 15. Um, right now I work like 30 hours a week. Um,
Okay.
but when I'm not in school, I work like 50 hours a week.
That's a lot, honey.
Yeah, it is.
What's your longest period that you stayed at one job?
3 years.
Okay. What jobs have you held within the last 5 years?
In the last 5 years, I've worked predominantly like with children. I when I was in high school and through like a little bit of college, I worked at Kohl's. I was there for 2 years, um, like the department store, and then
Hmm.
all through college, I worked at a daycare center um, that I really enjoyed, and then currently I work at a private school.
Okay. Have you ever been arrested?
No,
No jail time, not imprisoned. I bet
nope,
you don't even have a parking ticket.
no, that I don't either.
So, what is it that you like to do?
You mean like hobbies?
Yes.
Um, I like to read. I like to spend time with my mom and my grandparents, um, and my dog. I like to um, I like to relax and like watch movies and do like skincare stuff, that kind of thing.
Okay. What do you like about yourself?
About myself, I have I think I have a pretty good work ethic. Um, I work pretty hard, and I like to get everything done. I have a good what's that word? I think I'm motivated with school a lot.
Okay. Do you have many friends?
I had a lot of friends in when I was in college. I was an undergrad, but then since we graduated, we all like went back home or started their own jobs. So I have a lot of friends that are like far away, and we still talk when we can, but like I don't really hang out with them anymore, which I think can contribute to the depression.
What about any childhood friends growing up? Do you have anyone that is still in your life?
Not really, no.
Okay. So, as far as the friends that you do have, even though some of them are far away and moved back home, what would you say they feel about you?
I would think they think that I'm a good friend too. That I'm. They always tell me that I'm a good listener and that I give good advice.
Okay. Are you sexually active?
Not really, no, not at the moment.
Do you have any particular fantasies, or behaviors that repeatedly cause you to feel intensely aroused?
No,
Okay. Have you been less interested in sex than usual?
I'd say yeah.
Okay. Are you uncomfortable with your gender?
No,
Are you in a relationship?
no,
Okay. No children? Never been married?
nope.
Okay. Get my notes together. Okay. As of now, I have no follow up questions. I will come back with a treatment plan with goals and objectives that will be useful for your future. I thank you for your time, and I will ask you to please wait in the lounge area for a short moment while I create your treatment plan so we can begin your process of you being a happier you. Okay?
Okay.
The end.
All right. Let me